this presentation, we will be discussing binge drinking and the effects it has on the body, the reason why people may binge drink, and the lifestyle changes that can improve their binge drinking situation. But what is binge drinking? According to the NIAA, or the National Institute on Alcohol Abuse and Alcoholism, binge drinking is a pattern of drinking that brings the blood alcohol concentration level to 0.08 or above. This typically happens when men consume 5 or more drinks or women consume 4 or more drinks in about 2 hours. Who binge drinks? According to the CDC, or the Center of Disease Control and Prevention, 1 in 6 U.S. adults binge drink about 4 times a month and is most common in younger adults aged 18 to 34. Binge drinking is twice as common among men than among women. The amount of binge drinking occurrences is higher with household incomes of $75,000 or more and higher educational levels, like college degrees. Binge drinkers with lower incomes and lower educational levels, however, consume more binge drinks per year. People with higher incomes are more likely to drink overall, but is also more likely to be moderated. How does binge drinking affect mental and physical health? Excessive drinking can cause damage to the liver and heart and cause multiple types of cancer. It also can diminish the gray matter and white matter in the brain. According to the American Addiction Centers, alcohol has been linked to over 200 diseases and health issues. The more common issues include the heart and liver. It is well established that alcohol damages the liver and disrupts the healthy functioning and ability to repair itself. Some people may even develop alcohol-induced liver damage from binge drinking, like cirrhosis and liver cancers. The presence of alcohol and increasing amounts of blood alcohol concentration in the body causes stress on the heart, and over time causes high blood pressure and can lead to heart attack or stroke. The American Addiction Center also states that individuals who consume a heavy amount of alcohol over an extended period of time can cause structural changes to the brain, especially the complexes associated with learning and decision-making. High alcohol levels can also cause memory loss.
Ways to control binge drinking. Some ways to control binge drinking tend to be more difficult than others. Admitting to binge drinking is the first and one of the most important steps in controlling binge drinking, although it may be difficult. The first step for someone to begin to control their binge drinking is for them to realize and admit that they have a binge drinking problem. They have to be aware of their problem in order to control or solve it. After realizing it, the person can begin by writing down how much and the type of alcohol that they are consuming. Brainstorming possible short and long-term consequences of binge drinking is another way to begin thinking about how to control it. Try and avoid triggers such as parties, certain people that are known for their binge drinking episodes, or peer pressure. Spread out consumption of alcohol and drink water between each standard drink. Another key factor in controlling binge drinking is to seek help. 2 of the most difficult ways to control binge drinking include admitting that you have a problem and then seeking help because you may feel that binge drinking is a moral weakness or a character flaw. In conclusion, binge drinking can be an unfortunate side effect of unhealthy drinking habits. The nursing field has the ability to come up with nursing diagnoses and coping mechanisms to help combat binge drinking. There are many negative side effects of binge drinking that have an effect on the daily activities of a person, whether it be socially, economically, relationship-wise, or friendships. Nurses provide resources to help those suffering from binge drinking and offer support without judgment.
Binge drinking coping mechanisms. The reasons people binge drink include stress, boredom, anxiety, traumatic events, and depression, to name some of the common ones. These are triggers that cause people to start drinking more and more. Reducing the effect of these triggers is the key to improving binge drinking. Reasons people binge drink. How triggers influence binge drinking is social interaction with people who drink or binge drink can create a ripple effect being in that social environment. The excuse of having a party or get-together can be a gateway into binge drinking. Mental illness, such as anxiety and depression, along with loneliness and boredom, put stress on a person suffering from binge drinking. Environmental triggers can also influence binge drinking. Things such as close death, layoff at work, hard day at work, or a relationship or family issue can trigger a person's need to drink. Coping mechanisms and ways to prevent. Ways to cope with this include not being around people who are drinking or who are advocates when a person is going through binge drinking. The CDC recommends strategies to prevent binge drinking that includes not choosing to drink too much or follow the U.S. dietary guidelines, being that 1 drink per day for women and 2 for men. They also recommend talking to a healthcare provider about drinking behavior and requesting counseling if a person feels like they have a problem. Risk factors to binge drinking. Some of the risk factors for binge drinking are not due to emotions, but of circumstances. Some of the risk factors are preventable, but the genetic conditions are something that healthcare providers can't warn against or control them either. However, a healthcare provider can help to intervene when a person is binge drinking by helping cope with the risk factors and preventing these triggers. Risk factors can include low socioeconomic status, large amount of pocket money, excessive drinking socially, high risk pattern of consumption in parents, and genetic conditions that predispose to harmful use of alcohol.